So, dear colleagues, welcome to this press conference to, as usual, have an overview of the Quebec situation as far as COVID-19 is concerned. The Premier of Quebec, Mr. François Legault, is together today with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health of Quebec, Dr. Horacio Arruda. Mr. Premier. Yes, hello everyone. Well, I wish to start by telling you that I understand that the fighting that we are having right now against the coronavirus is lengthy, and we have to be realistic. It's going to last weeks. And of course, it is important to keep our spirits up. But I also understand that there are people who are stressed out, who are anxious, who are depressed. And the message that I want to give you today is that if you feel that you are losing your grip, please do not hesitate in consulting someone. It's important. All the kinds of mental health problems are just as important as physical health problems. And I want to take this opportunity, and these will be my daily thanks. I wish to thank all social workers who are helping out, for example, in youth centers, but also who are helping out all those people who are having problems with their mental health. I know that my wife, Isabel, calls a lot of interveners. Lionel Carman also tells me really beautiful stories. There are people who really work miracles. So today, huge thanks to all of our social workers who care for those people who are having problems with their mental health. And if you don't feel well, I want to tell Quebecers there's nothing to be embarrassed about. It's just as important as physical health. So do not hesitate. It's almost normal in the present situation, what we're going through right now, that there are more people who are having problems with their mental health. Now the numbers. Unfortunately, today we have 3 new deaths. We are now at 25. In the name of all Quebecers, I wish to offer my sincerest condolences to the families of those victims. We now have 3,430 confirmed cases, an increase of 590. We have 235 people hospitalized. That is an increase of 43. But we have 78 people in intensive care. That is an increase of only 6. So that's the good news of the day. Fewer hospitalizations than we could have predicted. Fewer people in intensive care. So that clearly means that our health network is under control and there's a good amount of leeway for how things will unfold. A word today, I'd like to get back to the precaution equipments. Masks, the N95 masks, the procedural masks, the gloves, the gowns. I want to send out a message to everyone. Everybody, every single country, every single state right now is starting to place orders for those specific equipments. So we're no different than anybody else. We're okay in the short term. But if the curve spreads, well, everybody is going to need more. And now we are following the orders, which are the ones that are confirmed, which are the ones that are not confirmed. Material is coming in every day. But I also want to tell all the staff in the health network, and as well those who work in safety, those who are outside of the network, it's important that if it is not necessary to use that equipment, to not use it. Save it for those who really need it. As other countries are studying it right now, we're also studying the possibility that masks N95 can be reused after having been sterilized. That does exist. It is being done in certain places. Of course, we are no different than anybody else, so we are looking at what has to be done. Washing those masks, if necessary, so that they can be reused many times. We are also having very advanced conversations with many Quebec companies in order to manufacture masks gowns, gloves, and know that there are Quebec businesses right now that are working night and day on that, and I wish to thank them. It is possible that in the next few months we will be needing them, so of course we are trying to have delivery dates that are going to be as quick as possible. But we are no different than others on the equipment. That's why we have to be careful not to waste them, not to use them when it isn't absolutely necessary. Another point on which we've been studying lately, all the staff that is in businesses giving essential services. I know that there's a lot of people who have worked 7 days a week and they're starting to get tired. So today I am announcing that for the entire month of April, businesses are going to be closed on Sundays. The idea is to get the employees to have a rest. So all businesses will have to close except service stations, dépanneurs, pharmacies, and takeout services in restaurants. But that means that the big grocery stores, for example, we want those employees to be able to rest. I think it'll be good for everyone that every Sunday in April, grocery stores will be closed. Now, another great priority, and we've been repeating it since the very beginning, the entire situation in residences and homes for the elderly. Marguerite Blais is in contact with the different management teams of all those establishments. Today we're announcing that we are adding a budget of $133 million. This is a specific budget for the length of time of this crisis. The idea of it, the objective is to better protect the residents, but also to better protect the staff that works in those residences. I understand that when there are people who get infected, it can be worrisome, so we have to protect ourselves. We have to follow the procedures, but I would also like to thank all the staff that works in the residences and homes for the elderly. I would like to end by repeating the 3 great priorities of our plan. Don't leave the house unless it's absolutely necessary. When you go out, if you need to go out, always stay at least 2 meters away from other people. And as soon as you arrive at home, wash your hands for 20 seconds with soap. It's important to respect the guidelines. There are Quebecers for whom it's a question of life and death. So those Quebecers that don't respect those guidelines can have very serious consequences. So I'm asking everyone to respect them, and I count on all Quebecers to respect those directives everywhere. English?
We're facing a long and tough battle against the virus. We'll need to keep our spirits up and to keep our forces. That's why we're announcing today that businesses will now be closed on Sundays, except for gas stations, pharmacies, convenience stores, and takeout in restaurants. It will be an opportunity for our workers to get some rest. Quebecers must remain united to win the battle against the virus. Everybody must follow our plan. Don't go out unless it's necessary. If you go out, keep your distances. And when you come back home, wash your hands. That's how we'll save lives. I'm counting on you. Thank you all.
Merci, Monsieur le Premier ministre. Alors pour la
Thank you, Mr. Premier. Now for the question period. Hello, Mr. Premier. As you know, there are premiums for psychologists and attendants, electricians, plumbers who are ending today. So the unions are asking for a guardian angel premium. Yes or no, will they be renewed beyond the 1st of April? Well, what we would like, ideally, is to improve upon them. We would like to have premium for the attendants that have very low wages. So I'm going to let the bargaining go on. It's being done at the table. But what we would like to do is to have those premiums, so to improve the wages of attendants for the next few years so that there's no worries in 6 months, if, thinking that it's only temporary, we have to keep our people, and our people have to stay long-term into the healthcare system. But you're telling people right now who are working on the front lines that as of next week, they have no more premium. They won't see that on their wages. That's not what I'm saying. What I'm saying is that I wish that in the next few days we can even improve on those premiums, that we can in certain cases include them in the wages of the patient attendants. We've been saying it for months. We want to improve the wages of patient attendants.
Bonjour à tous, Monsieur Legault. Au début de la crise,
At the beginning of the crisis, you mentioned that there would be Quebec businesses that could be asked to manufacture equipment, the gowns and masks, etc. What is happening with that? Is it more complicated than planned for? Is it ongoing? And what is happening with the millions of the N95 masks that were awaited from China that we were speaking of recently? Well, first of all, no. What we want with Quebec companies, on the contrary, I wish to thank them for their collaboration. What we're trying to do is that the deliveries will start in a few weeks rather than starting in a few months. So we are having talks with people. There are people working on this. We, in certain cases, are helping with the funding of the research, the production of prototypes. Sometimes we need to have material that also comes from China for the manufacturing, so it's all of that. As far as the N95 masks are concerned, they come from pretty much everywhere in the world. There are deliveries that are being planned for in the next few days. But we have to be certain to have them for when we get to that peak in a few weeks. This morning we could see surgeries, treatments that are being postponed. Certain are not as urgent, for example, for the hip, but there are treatments like mastectomies for women who have breast cancer. Could you explain why it is necessary right now to postpone those surgeries, whereas the hospitals are not necessarily full for the time being? Yes. First of all, what I wish to say is that these decisions are not taken lightly. It's a committee of scientists that exists at the ministry, but that also exists in each of the establishments, and they are the ones that make the decision in light of the clinical information that is solid. The College of Doctors is implied. The specialist associations that are concerned are also involved, so it's temporary. And of course, we do that because we absolutely must free up beds, first and foremost. Free up staff as well. Our great issue right now is to have enough staff, especially for the intensive care beds that we are going to be opening up. We're going to have more. There's already 500 that have been freed up, and we want to have 500 more because we have to, look to the peak, and we have to have that staff. That is why we are freeing these beds up temporarily, and it is not putting those people at risk. It is being very well evaluated by a scientific community. There's also the question of protective equipment that we really have to use very judiciously. So I reiterate that those decisions are made with a scientific committee. The involvement of specialists, the involvement of the Collège des médecins as well. Just to complete, I also asked that question by thinking, well, today there seems to be space. Why don't we do more? Well, we do have to take into account that the average stay for elective surgeries is 4 days. What would be the situation in 4 days? Well, we don't know. That is why it's better to prevent.
Monsieur
Legault, does the present crisis does not prove that the minimum wage should be at $15 or even $16 an hour? Well, there's a standard that is pretty respected everywhere in the world. The minimum wage should be at about 50% of the average wages to be able to keep incentives on certain jobs. So that is what we've done for the past year and a half. That is what we will continue doing. Now, what will be the average wage in 6 months? It's difficult to know, but we have to be prudent. There are certain jobs in certain regions, certain jobs for students, where if we increase the wages too quickly, the minimum wage, it could have negative impacts. Of course, there is a specific situation here, as we tell you, with the $2,000 per month that is being offered by the federal government. The Minister of Finances is working at this and will be announcing a program that will make it that people who are working in essential services will make at least $2,000. Dr. Arruda, there's a specific situation in the Eastern Townships. The Direction of Management of Public Health in the Eastern Townships is a very affected period and they are losing people, soldiers, if you will. Is there a specific intervention that is being planned for the Eastern Townships? It must be understood that the Eastern Townships are getting themselves organized and are asking for help. Most people are not necessarily hospitalized as well because they are relatively young. So they could be, for example, working from home. But right now, the Eastern Townships, with the help of others and with the mobilization of other resources, they can offer the services of case and investigation as such. So we're following the situation. We speak with them often, and that is a story as could take place elsewhere. So people who are not very symptomatic, who don't realize that they are the vector of COVID-19 and who at some point, people traveling in the same car, for example, those kinds of things. So right now, there's no problem with the Eastern Townships in terms of services to do the cases and investigation. If there were, we would mobilize ourselves with other regions to do the work. First, yesterday, Monsieur Arruda, you talked about the flattening of that curve. By flattening out the curve, I imagine that it prolongs the period where, of course, there will be an effect on the population. To what extent do your models bring the measures of confinement that we're experiencing right now? I mean, we know that there's a date that has already been talked about going back to school, which is the 1st of May. There's a doubt right now that it will be possible. Does that mean that the confinement period will be lengthier than what we were expecting at the beginning? Not necessarily. If you'll allow me, I would also like to tell you that each day you reevaluate the situation to see the success. We also have to know that even if we've taken measures, depending on how the Quebec population is applying them, it will have an effect on the efficacy of the measures. So that is what we do in public health. We prescribe and we give a prescription. I don't know if you've noticed, we went from a period where we really tried to convince, and now we're getting to a certain level of constraints to avoid outbreaks. What I can tell you right now is we are in a situation which is under control. We have, as predicted, a treating capacity if it were to increase. We have significantly increased screening tests. We were behind, and we've come back very much forward. In terms of rate per 100,000 people, we are increasing in the international scale. To my knowledge, we're now the 6th. The first is Iceland, Norway, Alberta, New York, and Quebec in 5th. 1, 2, 3, 4, 5. So we are at 808 tests per 100 people that are being done right now. So we are testing a lot. We also are testing people who perhaps in a different context would not have been tested because they don't have many symptoms. What's important is to see the rate of hospitalization and of serious cases. So I would tell you that those indicators are, we don't have to stop things, of course. People should not stop the guidelines. We are tightening them. But right now, we're making an epidemiological analysis of each sub-territory to decide if there are any specific confinements that should be brought about. What I can tell you, without going into scenarios and numbers that are too detailed, but depending on the actions, according to the actions that we've set up, we are observing effects, and we cannot necessarily compare from one region to the next because of the number of tests on the one hand, but also who the tests are applied to. Monsieur Legault, I'd like to have some more details on what you said earlier, the grocery stores that will be closed on Sunday. Will that not have a risk of concentrating more people in the week, since we are reducing how often those stores are open? I don't think so. I don't think that we can require to have full services 7 days a week for weeks and weeks. I think that it is possible to have services over a 6-day period. Of course, the very essential services like pharmacies or convenience stores, the dépanneurs are staying open, but I think that will allow for those employees in grocery stores to have some rest and to come back in better shape on Monday morning. Mr. Premier, first of all, are you putting aside the idea of imposing working conditions to your 500,000 employees? There's no question of imposing work conditions. What I want is to have a settlement with the unions. It's no time to go into war with anybody. But of course, we have to be two to tango. So both parties have to be able to agree and get to an agreement. I think that it is to be wished for to have an agreement. On the one hand, to improve the wages of care attendants, but also that it plays out within 6 months or a year. We don't know for how long we are in this crisis. The situation in the United States is evolving very quickly and not necessarily in a positive way. Are you getting any signals whatsoever? Are you having any worries about the supply chains of any kind, whether it be food, stuff, or anything other? And have you taken measures to, in case we have no worries about the food chain? We are setting up very strong measures for this summer to help people in the agricultural domain in order to be able to announce a kind of bonus for people who will accept to go work in the fields. I think that everything that we buy, that we call local purchasing, we're going to promote that a lot in the next few weeks, in the next few months. So we have to go help our farmers, and we have to have more products that come from here rather than the United States. But it has to be understood that we have a lot of products that come from the United States in the winter. In the summer, we do produce a lot. Now is going to be the challenge of foreign workers, but we are going to have the workforce that is going to be available, and now we have to put incentives so that those people choose to go work in our fields. I'd like to go along the same line with that question. Are you preparing Quebecers to a lengthier period of confinement, taking into account what you just said, because you don't know how long this is going to last? Well, for the time being, what we are saying is that all businesses are closed until the 13th of April. It will be reevaluated by then. It has to be understood that if we accept except for a few states in the United States, we are one of the few states that have closed so many businesses, like manufacturing and construction sites, etc. We also have announced up until now that schools will remain closed until the 1st of May. It remains the objective, but we reevaluate, and we will be continuously reevaluating the situation in the course of the next few days and weeks. A subject that has been discussed quite a bit, the equipment, particularly the protective masks. According to your estimates, particularly for the Montreal area, how long do you have some left? Will you have some left if you think about cleaning them? If you're thinking about cleaning them, is it because we're about to run out? First of all, we don't look at it regionally because we make sure that all regions have enough in proportion of their population and the needs in hospitals so that they have enough equipment. So if there's a problem, it will be a problem everywhere. It's not going to be a problem only regionally. We have some equipment for the short term. Now, there are orders that are supposed to be arriving in the course of the next few days and the next few weeks. Will those orders all be confirmed? That's why we're taking no chances, and we're preparing a plan B with Quebec businesses that could, even if normally they don't manufacturing masks or gloves or gowns, but that they could do it for this exceptional situation. I would also like to add something to that, Mr. Premier, about the masks. And once again, I spoke with the the directors of the establishments just this morning. It is confirmed that the operations have improved. That is to say, I was telling you last week, the establishments haven't been used to a situation like the one that we are experiencing. They had masks right beside them, so it's no longer the case. We have to protect the masks. So establishments have gotten themselves organized so that the supply operations be done optimally. That's the first thing. So it's more stabilized throughout the days. The other thing, and that we really must insist upon, is a judicious use of masks, whether they be the N95 or the procedural masks. So there's a video that's going to be coming out this afternoon or at the very latest tomorrow that will explain exactly how to use those masks. The procedures are already set up, and a video always helps. But what I wish to say is that we really have to make sure that the N95 mask, for example, be used for the right interveners in the correct procedures. I do not believe that it is normal that a security guard has an N95 mask on. Do you understand? That is one example. But there's others as well. I know that people who are in, for example, CHSLDs, youth protection, or they go to people's homes, they're concerned. They have what they need, but they absolutely must use them in the correct circumstances, and that is why we are continuously reviewing the processes to be able to use those masks correctly in every sphere of activity network. That is the condition that will allow us to have enough for everything that is upcoming. We really have to use those masks at the right time, and the right people have to use them.
Bonjour à tous. You're
telling us that things are better than predicted. We don't have the choice to believe you since you're not giving us access to what had been predicted, your scenarios. But half of the confirmed cases in Canada are in Quebec. Why? I've explained it many times. I'll repeat it. The testing strategies can vary. And to be able to answer your question and to prove it, I would have to have exactly the testing strategy that was used in the field, not necessarily what is published on the web, because there is information that isn't always necessarily easy to get. We do a lot more testing now. We are much above Ontario for a population that is twice ours, if not more. So in increasing significantly the number of tests that we are conducting, we detect cases that are often not as serious because we're testing more. So as soon as people have a few symptoms, we do it. What we have to compare are the hospitalization rates and serious cases, because in fact there is no country apart from the ones that had phenomenal quantities and who tested everyone. But the more we go forward in the season, fewer there's going to be colds and flus, and the more likely it is that it will be coronavirus. So that is true that in absolute numbers, we have more cases in Quebec. But now compare it with the numbers per rate. And also, let's understand, did their strategies go get everyone? There are probably, and as I was telling you, these are hypotheses, and it's not just me who is making hypotheses, it's being analyzed with experts. There are probably people who would have been tested with the Ontario, with our strategy, but who in Ontario are not tested, for example. Monsieur Legault, what is your strategy to be able to talk with the cultural communities? Are you going to repeat the experience with the Liberal Party? Have you thought of having new strategies? Well, first, there are guidelines that are given in many languages in Montreal. We know that there are certain communities that are more affected. For example, the Jewish community. So we've talked with the people at CIJA. The Director of Public Health has a meeting today of the Laurentians area. They have a meeting with the Orthodox Jewish community of Boisbriand. So we are trying, case by case, whether it be in Côte-Saint-Luc or Boisbriand, we try to intervene and to quickly set up all measures with the support of the community. And up until now, it's going pretty well.
Oui, bonjour, Monsieur le Premier ministre. Il y a plusieurs des mesures que vous avez...
Many of the measures that you've announced, or that the federal government have announced, for which we are getting close to the 12 to 14 day delay that have been evoked to see the fruits of these measures. For example, the closure of schools and municipal infrastructures, as well as the borders, shopping malls. And should we understand that the hour of truth is arriving, that it's this week that we'll be able to determine whether this is efficient? The hour of truth is every day, if you'll allow me. Right now, the rate of growth of our cases, even if it is important, and we have to understand that there's a testing backlog. There are people who were tested a few days ago, who should have been counted a few days ago, but who are counted on a later day. At some point, we will be rebalancing the quantities of tests with the need and the results of analyses so that we have as much as possible. We're even evaluating new tests for which we could have an answer right away. So you understand that it's a situation that evolves a lot. What I can tell you is that we are adding measures as well. We talked about that at the beginning. The first measures that we took at 12 days, probably, and that we'll see in hindsight, they probably already softened the curve. It didn't prevent community transmission in certain regions, for example, in the region around the Montreal hotspots, but we added measures now to protect the eastern and northern of the province. We've put bigger constraints to movement. These are all measures that complete one another and add and get added, and it's very different to know the effect that a measure placed 3 weeks ago has. But what we are observing is that the growth, and I mean, we could have a curve by changing the axis of the x's, and the growth, the exponential growth right now, we're not in an exponential increase of cases. We are in an increase that is normal and expected. And you'll understand that if we want to have a curve, it has to go up. And at one point, it's going to have to get to a plateau. So it's normal that it's going up. It's the speed at which it is going up. And you'll remember the reason why we're doing that. It is to flatten the curve to avoid that there are two people that overwhelm our healthcare system and occupy the intensive care unit beds and lower our ability to treat and have to choose who we treat. That is why it is so important that Quebecers listen to the public health guidelines. That is what most people are doing. But now we have to do it to the utmost if we want to reap the fruit of these actions. About the hospitalizations, every day you tell us the number of people who are being hospitalized and who are in intensive care. Do you have any data on the number of people who have been hospitalized who have been allowed to leave, or how long on average they stay in a hospital setting? And if we quickly calculate, it's about 7%, the hospitalization rate. Does that go along with your predictions? Yes, and you have to understand that we're expecting a hospitalization rate that was around 15% with a proportion of intensive care right now, and thank goodness it is the case. Just to give you an idea, because people are scared as such, out of the 25 cases, and I want to present my condolences to the people who have experienced this, because, we look at it as statistics, but we know that for each of the families, it's a drama. So there was one case between 60 and 69 years of age, 6 between 70 and 79, 16 cases of people between 80 and 89 years of age, and 2 cases of people 90 years and over. So that means that 88% of the cases are people 70 and over. 8% of cases are 90 and over, and there's 80 and over, and there's a 4% that corresponds to the person who died in the age category, the 60 to 69. The vast majority of these people had conditions because they were older. So they had chronic diseases, they had cancers or other diseases, which means that what we feared was that the elderly people would be attacked. That is the case. That does not mean there won't be a young person at some point who won't end up in intensive care with complications, but the present profile is what was expected. And it is situated in places, for example, residences for the elderly, which correspond to 40% of cases of deaths. I'm talking about deaths here, not 32% in CHSLDs and 16% at home, and 12%, which right now is unknown about, the information that we have right now. So that is why I dare say that the situation is serious, because it is killing people, but it is under control. And what is happening was, without talking about numbers, But in terms of rate of attack, rate of hospitalizations, it is below what is being observed elsewhere, which means that a lot of our cases are cases that perhaps would not have been tested elsewhere, which makes it that it's very difficult to compare ourselves, and which makes it that, in fact, in Quebec, by testing more, we detect cases that are cases that normally we wouldn't even have tested in the context where they didn't have such important symptoms of fever, coughing, or respiratory illness, because if they had been very symptomatic, they would have ended up in hospital. This completes questions in French. English now.
Good afternoon. Premier Legault, how worried are you about the situation in Boisbriand? The fact that a whole Hasidic community has been put under quarantine. You're basically, in this major decision, reducing their rates. But you're saying to Quebecers that was necessary?
In fact, you should understand that the person who has the most information about this is Dr. Goyer, who is the Director of Public Health for this region. But I'm aware of the situation. First of all, we don't act on religions. We don't act on what it is. We work on epidemiology. What is the diagnosis of this specific community? The specific community had relations with New York because there is travels coming back from New York. And I don't want to comment about what is going on exactly inside, but yesterday they get tested people who have COVID-19. What is exactly their state? From what I know, nobody died from it. But there is in this community, which is very tight, that is together, we want to protect them from getting the disease in others. We want to control inside of this community, the same thing as we're doing in Quebec, elsewhere. And we want to make sure that they're going to be a hotspot for going to neighborhoods and infect that. But we have to have this transmission inside of a place to decide to stop things externally. It is first for their own health we're doing that. As we will do anywhere in Quebec, Île Verte, or any place, we will do that. Not based on religion or anything. Based on there is people there that have been infected. There is a risk of high transmission in this community, and we want to make sure that we can give them good treatments, make sure that we lower the transmissibility inside of their community, and make sure that this situation don't go away and be another, I would say, explosive hotspot going to give it to everywhere. So that's the decision that have been taken, and this community has collaborated very well since weeks. They stopped schools, they stopped their church inside, and now they have been exposed to New York, which is a situation that was planned. Not planned, but it was an hypothesis. Because there is, as we have traffic with France, we got our case from France, from the congé scolaire.
Juste un instant, Cathy, si c'est possible de répéter.
One moment. Would it be possible to repeat in French concerning the Montreal Jewish community? Yes, you have to understand right now it is the Laurentians, Dr. Eric Laurier, the Director for Public Health, who is responsible to have the sub-regional analysis of his territory. In the community that we're speaking of, which has been a lot in the media, there's an important relationship with the New York community. It is not on the basis of religion or anything else that decisions are made. They are made on an epidemiological basis, which is our populational diagnosis. That means that in this community, there are people who are affected by COVID-19, which was probably imported either from elsewhere here in Quebec, but also possibly from New York. This is an important hypothesis. In order to protect them, in order to ensure, to decrease the impact of this epidemic within that community, and they're very tightly knit, measures have been taken, for example, closure of schools, synagogues, etc. Lab tests that have recently arrived confirmed to us the presence of many cases in children as well and in youth who could transmit the disease within the community as well as outside of it. In collaboration with the community, the Director for Public Health has increased the level of intervention. That is to say, after having closed down the schools and made recommendations, they are going to keep an eye on the situation, make sure that people have access to care and adequate treatment, and avoid that this zone contaminates its surroundings, because it's not a closed community. So there will be a control in collaboration with the said community. These are citizens. They are doing their share to not be the source of a public contamination.
Yes, my second question, sorry. Okay. Some family members of people in seniors' home think that those who tested positive, those patients should not be returned to seniors' home. They should be put in different separate facilities. So the ones who tested positive living in seniors' homes should not go back, but should be put in separate facilities. So what is the kind of support that you may give to those families who want to help their elderly, their loved ones?
Yes, and we're very, very sensitive to all this, and we're trying to really help in the best fashion possible. First of all, what we have to say is those people are isolated in the residence. They're really isolated from the others. There are measures that are taken, and what we're announcing today, and Madame Blais is also talking about it in the media a lot today, is $133 million, and a part of it is for the residents and to help them, to add staff, for instance, to help with the situation, to help with the security too. So what we're saying is that the best way possible is to isolate those people from the others in the residence, and we're helping them with additional measures, and we will fund those additional measures in those residents.
Thank you. So now a few questions sent by email. The first one is from CTV News. There seems to be some mixed message about wearing masks. Is it still your opinion that those who do not have COVID-19 should generally not wear a mask? And if so, what are the disadvantages?
There is no new data that will support changes that we said. The most important thing is to wash your hands. If you're sick, you don't want to expose others, you can wear a mask. If you're a healthcare worker or a first respondent person who will have to have a contact with a case, a possible case, it's important that you get the right material for the right thing to do, for the right person at the right time. So, as we have a big problem everywhere in the world about getting masks, procedures, surgical masks or N95, it's very important that people don't steal masks, that people use them in the right way. Having a security person in front of a long-term care facility with N95 mask is a waste. And we are asking people to really proceed and use it as recommended. And my minister told there's going to be a video to make sure people understand. So if you're getting away, you're not sick, you're going outside, you don't need a mask, please wash your hands, because it's your hands who could be in contact with objects in the city that will make you sick, even if you get a mask.
Now, a question from Philotier, Montreal Gazette, for Dr. Arruda. Dr. Mylène Drouin of Montreal Public Health says about 200 people per day test positive. And on many days, 30 or 40 positive people cannot be found to be told they are positive. Santé Publique Estrie says the same thing happens there. So where are these people, and are they a threat? What can you do?
In fact, I just want to share, I'm sorry because you're
a little bit far
deep from that ear, and I should turn that way. It's about the tests. There is 200 doing by day, and there is people who are tested positive. Reach them.
It cannot be found.
Okay. Exactly. First of all, I think that's not the principal driver. I hope but it's important to get the address and get the test. I hope that those persons, because in fact, if you have been tested, you're not supposed to get away without being. I think that because people probably, I cannot comment on a specific situation, but perhaps they went somewhere else and we don't have the right phone number. I hope, if it's that your case, you've been tested, don't go see your family, your father, your mother, or go to anywhere without receiving the test, or call your public health, and everybody can have the number, call the public health to get the results. Because no one tested should go away without having an advice from a public health or their own doctor.
So keep your phone close.
Yes.
And another question from Mr. Routier for Minister McCann. Quebec about advertising saying, don't forget about mental health. Mr. Trudeau spoke about kids being anxious and gave money for help phone line. Will the RAMQ cover the cost of psychologists and therapists treating people with anxiety and other mental issues related to COVID-19?
Yes, and we will also cover people who are immigrants who don't have a card. We will cover them too. It's very important to give the services, the physical services and the mental health services. So we have at this point 325,000 people who are known to workers in the system, and they're being called at this minute. All of them, they will be called to offer support. All the people on the waiting list also are being called, and we are inviting people who have anxiety to call the CLSC, to call the support lines that exist in Quebec, and that's why we're making this publicity every week. It's going to be in the press to give all the information about all the support that is available for people who have anxiety or mental health problems.
Next question are for Global News from Raquel Fletcher, asking, are measures going to be put in place to aid tenants who won't be able to pay their rent in 2 days, since some landlords are demanding that rent be paid on April 1st, no matter what?
But first, like I said, I ask owners to be comprehensive. Everybody will receive a check of $2,000 a month from the federal government. So I'm asking them to wait a couple of days, couple of weeks until they receive the check. And the Régie du Logement will not accept that some people will be thrown out of their house.
And last question from Raquel. 7% of cases seems to end up in hospital. What does this mean? And is it because we are testing and catching people with symptoms early? You say this is a good news.
In fact, we were thinking that I would say around 80% of the people will not need to go to hospitals. We think, from what we've seen in other countries, that 15% of the people will go to the hospital. We got a 7% rate, actually. We got people in intensive care. I think it's a good news. And we are testing a lot. Even if we get a lot of cases, they are not ending to the hospital and to the intensive care. So it's probably related to our quantity of tests and our test strategy.
So that's all the time we have. Merci tout le monde et à demain.
Thank you, everyone. See you tomorrow.